Lockdown till at least the 8th of March and schools shut till then at the earliest. It was the news parents in England were dreading. Now there are weeks of more homeschooling ahead.
I'm hopeful, but that's the earliest that we can do it, and it depends on lots of things going right.
But there are now mounting questions about just how far the terrible COVID figures have to fall before the government relaxes the rules. So what are the metrics the Prime Minister is working to? Robert will join us shortly. Also on News at 10 tonight. Why our borders are now shut to Brazil, the new variant laying waste to a new wave of victims. Fear, distrust and discrimination raggy on the deep suspicion of the vaccine in some Black and Asian communities. Our task is to organise the Games, not cancel them. The Olympics chief insists the show must go on. And
out.
Waiting to exhale, the opera singers helping COVID sufferers get their breath back.
This is ITV News at 10 with Julie Etchingham.
Good evening. For a nation shaken by 100,000 deaths but desperate for an end to lockdown, the Prime Minister tried this evening to end some of the uncertainty. Basically, it is more of the same lockdown-wise in England for another 5.5 weeks minimum. Homeschooling goes on. Schools themselves won't reopen straight after half-term. The very earliest that would happen would be from the 8th of March, and only then if the vaccination programme is on target and other virus indicators are heading in the right direction. And only after that would restrictions start to be lifted. Today, case numbers fell, but other indicators were going in the wrong direction. The daily vaccination total was below target, and the number of deaths was up again to more than 1,700. That's the second highest figure of the whole pandemic.
For another 5.5 weeks in England, cafes will remain closed. Many shops will remain shut. And today, the Prime Minister said that places of education would remain largely empty.
It is sensible now to serve notice that we will not be able to reopen schools immediately after half-term on February the 22nd. But if we continue to make the progress that we want to see and that we believe we can see, then we hope to begin opening schools on Monday, March the 8th.
A lot does have to happen before then. By the 15th of February, all the most vulnerable people should have been vaccinated. Then the government will publish data on the effects of the vaccine and the lockdown and the existing rate of hospitalisation. From March the 8th, subject to that data, they hope to start reopening schools, then maybe easing other restrictions. Scotland, Wales and Northern Ireland are all on a similar trajectory. A big unknown for everyone is how much vaccines will reduce not just the severity, but also the transmissibility of the virus.
In terms of transmission, it's much more difficult to get a handle on that at the moment. In other words, how likely is it that if you had the vaccine, you would never catch the infection or you couldn't pass it on? We think they'll be partially effective there.
In any event, Labour want the Prime Minister to order the vaccination of school staff before they return.
He should bring forward the vaccination of key workers and use that window of the February half term to vaccinate all school staff, including every teacher and teaching assistant.
But Mr Johnson's advisers say schools are safe for teachers, even if the virus is spreading amongst the children.
Is there a clear signal in the data of a markedly increased rate of infection or mortality in teachers? No. But could infected children introduce the infection back in their own households and therefore contribute to R? Absolutely yes.
So what are his thoughts on the other restrictions? Are you just looking at reopening schools, hopefully, on the 8th of March, or do you think other restrictions could be eased then as well?
You will be looking simultaneously at the other restrictions that we have, what we can do in those sectors as well. And as I said earlier on, I will be setting out by February the 22nd more of a route map.
After the terrible milestone of 100,000 deaths, it is, perhaps intentionally, a glimmer of hope. But the 8th of March still feels a long way off. Carl Dinnan, News at 10.
Well, if and when schools in England do reopen on the 8th of March, it'll add up to almost a whole year of disruption. Most UK schools locked down on the 20th of March last year. Parents in England had been told they would reopen after February half-term. Because of the delay, the Prime Minister said children would get a programme of catch-up tutoring with the aim of making up for missed lessons over the course of the current Parliament.
Are you excited to go back to school and see all your friends? Yeah.
In Lancashire, this homeschool has quite a big class. Donna has 5 children, including 2 sets of twins and 2 with disabilities. She's mastered playtime, but the rest no longer feels like much fun.
Children's mental health and well-being can't sustain much more of this, and neither can parents. No, they do regress when they're not learning in the classroom. I've seen regression in my children. You know, we're not teachers and we're not capable of doing that job either.
And we now know school's out for winter, as tonight teachers plan for yet another new date.
And they're talking about to start reopening on March the 8th.
Like all schools, this secondary in East London is open to vulnerable children. The question's how to safely welcome back all others.
We have the firefight with the exam classes and we do all the work then, but then you're still going to get legacy issues with the other classes.
It is the legacy of lockdown they're learning most about here.
When you're doing remote education, it's all in the word, isn't it? It's remote. So we can do lots of great things which we're doing in school in terms of making sure our children engage. But I do have a concern about children's well-being. You know, they're sitting learning from a screen for a long time. Our parents are worried about that. Our children have said they're worried about that too, and certainly our staff are concerned as well.
But for many parents and teachers too, safety is an even bigger concern.
How much confidence do you have in the Prime Minister saying it's safe to go back on March the 8th?
Yeah, I mean, I welcome the announcement that gives us time to plan, and I think that's really important. But, I mean, whether a school is going to be safe at that time, you know, who knows?
I know the anxieties of the staff that we have in our school who are vulnerable. The vaccine would make us feel safer.
Tonight, schools have no certainty about a start date and no answer about balancing short-term safety with long-term learning. Paul Brand, News at 10.
Let's talk to Robert now, who joins us from the set of his show, which is on a bit later, of course. Robert, this sort of feels like the lockdown to end all lockdowns. What do you understand is guiding the Prime Minister's thinking? Is the tiers system, for example, over, do you think?
So I'll get on to that in a second. I mean, obviously, we're all obsessed with whether lockdown will really start to ease on the 8th of March, whether children will go back to school then. I just interviewed, actually, the Business Secretary, Kwasi Kwarteng, for the show. You can see his interview just a few minutes on the show. And I said to him, is March the 8th a target? And he shook his head and said, absolutely not. I mean, you know, it'll happen, the easing of lockdown, if infections continue to fall, if they succeed in vaccinating all those vulnerable groups by the middle of February, and then they see in the hospital data that there were many, many, many fewer people going into hospital acutely ill. So, you know, there are still some considerable uncertainties here. And I have to say, when I talk to the scientists who advise the Prime Minister, they are by no means convinced that schools will be opening on the 8th of March, and certainly not all schools. One said he thought at best it would be primary schools. But the other thing which I think is incredibly interesting about what the Prime Minister said today is he implies he wants all schools to open at the same time all over the country. Now, that says to me that they are backing away from the regional approach, because it would only be safe to open schools all over the country if you had suppressed the virus down to a really minimal extent, and the transmission rate had been suppressed to a really minimal extent everywhere. So it does feel to me that there may be some mild regional variations, but it does feel to me as though maybe the tiers approach is going to be ditched. I think the most important thing that all of us care about, though, is just some return to normal, get out of this awful lockdown.
Indeed, Robert, thank you very much. We'll see you a bit later. Well, it has been a few days coming, but this afternoon the Home Secretary, Priti Patel, announced big restrictions on Britons flying home to England from virus hotspots abroad, 30 of them. People will have to isolate for 10 days in designated hotels without exception, she said. Ms Patel has also banned foreign holidays for the foreseeable future. Going on holiday is not a valid reason for travel, she said. She didn't say when any of this would start.
Back from Brazil via Frankfurt, this British resident seemed pleased to be home, but certainly didn't relish the idea of hotel quarantine in future.
The government tells us what to do, we have to follow. But if I had a choice to, if I had an option to do it or not doing it, I wouldn't do it, of course not, no.
This woman wasn't keen either, but accepted the new variants might mean it was necessary.
Personally, for my interest, personal interest is no, because I don't want to pay that fee. But if that's what it's comprehended to be the best for the well-being for everyone else.
The new measures mean that there'll be mandatory 10 days of quarantine at hotels for British nationals and residents returning from 30 banned countries on the so-called red list, including South Africa, Brazil and Portugal. The costs will be covered by the individuals in quarantine. It emerged last week that the Home Secretary had wanted to close the borders back in March, but today said now was the time to act.
These new measures at the border are a necessary step to protect the public and our world-class vaccination programme. Every layer of protection we have put in place will help to reduce the risk of transmission of this virus and any new potential strain from entering the UK.
One of the key areas where the government has clearly fallen short is on protecting our borders. And I'm deeply concerned that the measures outlined today are yet another example of this. Too little, too late.
Mandatory quarantine was used once before, a year ago, when British nationals were evacuated from Wuhan in China. Other countries, such as Australia, have used quarantine throughout the pandemic with great success, as one of their senior diplomats explains.
909 people have died with COVID, a population of a little less than half of the UK's. 909 people, it's a tiny number. So many of those lives have been saved essentially because of the quarantine system.
Here the hope is targeted quarantine will have some impact in reducing the spread of the virus. Libby Vina, News at 10, Westminster.
Brazil is on that red list of the world's virus hotspots, not least because of the new strain detected there. The city of Manaus, in the middle of the Amazon rainforest, was really badly hit in the first wave, and now it is happening again. Medical staff have told us people are being infected a second time from the new strain, and they tell us that more young people are dying from it.
The final indignity. There's no funeral service for 18-year-old Rafaela Silva, only a burial in the mud with a single mourner. Between sobs, her father cries, "I love you so much." The teenager is yet another COVID victim in the city of Manaus. A different variant is killing people younger and faster. All these graves have been dug in the last 2 weeks. It's causing panic. A family heave a critically ill man onto a trolley outside the Platão de Araujo hospital. There's a shortage of ambulances to collect the sick. Inside, there is a shortage of beds and staff, corridors overflowing with COVID patients, cared for by their relatives, mostly without any protective clothing. Ronaldo is trying to keep his father alive. The 61-year-old's heart stopped and he can't get the specialist care he needs.
Essa bagunça aí, os pessoal dividindo oxigênio, 3, 4, 5 pessoas dividindo cilindro de oxigênio. Cadê os oxigênios que chegaram? Entendeu? Cadê as doações que chegaram?
Oxygen was donated by neighbouring Venezuela after Manaus ran out. But demand's so high, families often have to buy their own supplies. At the mortuary, Andrea has come to collect the body of her grandfather, who spent 2 days in the corridor. They'd run out of ventilators for the 86-year-old.
Ele estava no
Medical staff believe that some of the patients struck down by this second wave have been reinfected. One nurse spoke to us anonymously.
Porque o que nós observamos que de novembro para cá começou a ter a reinfecção, até mesmo de colegas. Colegas aqui do SPA adoeceram, tiveram na primeira onda e se reinfectaram agora.
There is little time or capacity for testing, but the fear is that the first wave offers no immunity against this new variant. Perhaps even more worrying, at the airport, COVID patients are being flown to other states in Brazil. Ambulances relieving pressure on the hospitals in Manaus, but potentially spreading the more deadly mutation across this vast country. Juliet Bremner, News at 10.
And Tom, our science editor, is here. I mean, really disturbing details there in Juliet's report. It's no wonder that scientists are racing to find out as much as possible about these new variants, both in places like Brazil, but here too.
That's right. And we're picking up a few new hints about what our new variant is like. Firstly, people seem to be reporting slightly higher, more symptoms. More people report symptoms, slightly over half now. It was slightly below half before. And the balance of symptoms is slightly different. So sore throat, fever, cough, stomach upset, aches and pains are still there, being reported by slightly more people. But fewer people reporting loss of taste, loss of sense of taste and smell, which was one of those key signs before. So that's interesting. Also, the virus is proving it is more transmissible. About 77% of new cases are down to this new variant. Now, obviously, our variant, thankfully, lacks some of those potentially more worrying qualities that we're seeing in Juliet's terrifying report there, the ability perhaps to reinfect people or evade the immune system or make vaccines less potent. Obviously, we're closing our borders to try and reduce those strains coming in that originated probably in South Africa and Brazil. But scientists are telling me with high levels of infection, 75% of people with the new variant, 1 million new cases a week, the evolutionary environment for those new mutations to evolve here in the UK is still there. So really, we need to work very hard to stay one step ahead of the virus, keep the vaccinations coming and keep transmission down.
OK, Tom, thank you very much indeed for that. Well, the row between the European Union and AstraZeneca, the makers of the Oxford vaccine, have moved up another notch. The EU has demanded it should have some of the vaccine doses manufactured in the UK because of problems at the company's plants in Europe. The EU's health commissioner said, "We reject the logic of first come, first served. That may work at the neighbourhood butchers, but not in contracts." Well, for the vaccination programme to cut cases of the virus here and deaths from it, take-up is key. But surveys suggest there is a reluctance among some in ethnic minority communities to sign up for it, even though they've been disproportionately hit. We've been found that this is based on a distrust of the authorities because of historic parallels and current discrimination. The government is now starting to monitor the ethnicity of everyone being vaccinated to sort out the take-up issue. But so far, there are no plans to prioritise these minority groups.
The borough of Brent is one of the most ethnically diverse in the UK and one of the hardest hit by coronavirus.
Okay, you know Gujarati? Gujarati Mavre? Okay, Gujarati mein bol to.
Brent has mobilised multilingual ambassadors alongside its council staff to combat a worryingly high rate of resistance to taking the vaccine amongst its many ethnic communities. And people I met here who were reluctant to take the vaccine were open about why.
I need to know more information about it. And obviously, once I know more, then I can consider it.
I will not take the vaccine.
But you may be exposing others to their deaths. Is there anything the government could do to convince you?
So You believe anything that the government and its scientists would tell you. You believe that.
The Makkah Mosque in Leeds, despite the socially distanced Friday prayers, is just one avenue to try to convince people to trust the government's advice that taking the vaccine is needed to save lives.
Scholars, doctors, scientists.
But whether it's from the pulpits or from the webinars he does, Imam Qari says it comes back to one simple problem.
I've noticed that amongst the young people there is a lack of trust of authorities. And I've come across people who've said that, well, they don't care whether or not the vaccine is safe, but they don't trust the source where it's coming from. So I've realized that actually the messenger is as important in this pandemic as the message that we're delivering.
I heard the same thing from his Christian counterpart, Pastor Alton Bell. He says his community's distrust of government has accumulated over decades, from vaccine experiments on black Americans without their knowledge in the 50s to the Windrush scandal and Grenfell.
They want black people to take this vaccine and not explaining to them what the benefits are and what the risks are. Because, black people aren't stupid. We know what the risk-benefit analysis are.
Hello, namaste, sat sri akal, salam alaikum.
Efforts to combat misinformation about the virus in minority communities has also gone online, with some of Britain's best-known figures taking part in videos trying to dispel fears about the vaccine, as well as medics working on the front line. The government says it's reluctant to prioritise minority ethnic communities in getting the vaccine, arguing that the evidence shows that age and not race is the greatest factor in those dying of COVID. However, the new independent NHS Race and Health Observatory body says the focus has to be on race as well as age. You've said that this is a matter, as you said, of life and death.
We know that black and minority ethnic communities are at higher clinical risk from COVID-19. We need to act now and support those vulnerable communities. What the guidance says is that inequalities need to be identified, including those related to ethnicity, and addressed in the implementation of the vaccination program. Again, the question is whether that recommendation is being actually followed.
Unless the government and community leaders can focus on the urgent issues that make Britain's minority ethnic groups vulnerable to the virus, they will continue to suffer more than their fellow Britons in a pandemic that's laid bare the inequalities in British society. Raggy Omar, News at 10.
After the 75th anniversary commemorations of Holocaust Memorial Day last year, today's were always going to be on a smaller scale, and the pandemic made sure of that. The traditional ceremony, which takes place at the site of the Auschwitz concentration camp in Poland, was online only. Here this evening, national monuments were lit with purple in recognition of genocide around the world, and at 8 o'clock, candles were lit in windows across the country. Downing Street was among those taking part in what the organisers called lighting the darkness to stand against today's prejudice and hatred. The Olympic dreams of the 11,000 athletes due to compete in Tokyo in July are still on track despite the pandemic. The head of the Olympic movement, Thomas Bach, said he wasn't wasting time on rumours that they would be called off. It wasn't a question of whether to hold the Games, he insisted, but how to hold them.
Olympic athletes are used to training alone, but ever since the first lockdown, like Di Green, they've had to adapt. Now they face the added pressure of uncertainty. Will the Games go ahead, and if so, what will they look like?
There is a general feeling, certainly in the last week with indoor cancellations, that we're looking around like, oh, I was going to compete next week. Oh yeah, I was going to compete as well. What are we doing now? And that's not how you want to be training or preparing. You want certainty. You want to know what you've got to do, and that's the easiest way to get the job done.
Earlier this month, Tokyo entered a state of emergency. Opinion polls suggested the Japanese people did not want the Games, and there were reports the decision to cancel had already been taken. Today, though, the man who heads up the Olympic movement said the show will go on.
We are not speculating of whether the Games are taking place. We are working on how the games will take place. That means we have to put COVID countermeasures together for every possible scenario.
A cancellation would not only be unprecedented but financially damaging, especially for Japan, who have already spent upwards of £11 billion. British archer Tom Barber says Thomas Bach's words today that a safe and secure games was possible came as some relief.
As reassuring as they can be, in that nobody has the answers or nobody knows, what's going to happen next. But, I certainly, for one, have a lot of faith in, the many experts, the many people across the world who are working on this challenge and trying to solve it and come up with a resolution that's going to, deliver, hopefully, a safe games for us to compete in.
Assuming the games do go ahead, they're unlikely to resemble any that have gone before them. But clearly the current belief is that it is far better to compromise than to cancel. Steve Scott, News at 10.
Now to a story to make your blood boil if you struggle with poor broadband while working from home. They've now got it working perfectly in space 220 miles up. The first British bit of industrial kit to be fitted to the International Space Station is a terminal that creates a direct link to base at home broadband speeds. It means scientists down on Earth get results from experiments in almost real time. There was a pretty big upset in the Premier League tonight. Manchester United. And finally tonight, the undoubted power of music to heal. With no performances to stage, voice coaches from the English National Opera have been teaching people left breathless by long COVID to improve their breathing techniques. This fusion of the musical and the medical has been working, and tomorrow the collaboration between the ENO and the NHS will be rolled out to 1,000 patients in the northeast of England and across London.
The performers in the English National Opera are experts in the art of breathing, knowing how to make the most of every breath to deliver stunning notes. And now they are sharing their expertise to help those for whom breathing is a challenge.
I want your out-breath to be on a...
In the first project of its kind involving long COVID sufferers,
and out,
the ENO has been teaching its respiratory techniques to combat the breathlessness faced by some people who have not fully recovered from the coronavirus.
Richard Sheba, how does that exercise make you feel?
Calm immediately.
Calm immediately. Richard, what about you?
It's calmed my anxiety down. Immeasurably.
Got it? Let's try. And.
Richard and Sheba are amongst 12 people who've been on the pilot scheme between the ENO and the NHS, now to be rolled out nationally.
Prior to starting the programme, I felt left out in the wilderness.
If you don't get enough oxygen in, your brain sends the signal that, you're in this panic mode. So since then, I have not called my GP. I've not been tempted to call 111. So that's been the most fantastic part about it.
Unable to perform as normal at their home at the London Coliseum, the ENO had its costume department make medical scrubs for the Imperial College Healthcare Trust, then realised their singing specialists could offer more.
They understand the physiology behind breath and breath control. And so it became quite clear to us quite early on in conversations with GPs around long COVID and those symptoms of breathlessness that possibly the ENO had something really important that we could offer.
The NHS welcomed the outside help in dealing with the after effects of a new illness on their patients.
We call it a disordered breathing pattern. So they started breathing at the top of their lungs and not using all of their lung capacity. So we then thought, well, what else could we do? And there was very little out there. So we were really fortunate when Jenny and her team came to us.
Out, 2, 3.
Many more long COVID patients will now be offered these lessons in how to breathe. Nina Nanar, News at 10.
And that's it for tonight's News at 10, as many of us all take another deep breath before another few weeks of homeschooling. Good night. We'll see you tomorrow.